members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, I welcome you all to the national briefing of Monday, 15th June 2020. Let me once again use this opportunity to welcome you back from the 2020 Democracy Day holiday, which we all had to celebrate in a COVID-19 pandemic era. You will all recall that Mr. President, in his broadcast on Friday, 12 June 2020, admonished all Nigerians, and I quote, "Notwithstanding our aspirations, humanity and indeed democracy is under the threat of COVID-19. He added, I quote again, "Nigeria has survived many crises before and came out stronger. I am confident that by the grace of God, we shall overcome this one and emerge stronger and more purposeful." Mr. President's concerns about the impact of COVID-19 is underscored by the fact that 15 paragraphs of his broadcast were dedicated to COVID-19 issues. This buttresses the fact that the virus is still very deadly and everyone must take cautious effort to stop the spread by adhering to the guidelines and measures prescribed by the Presidential Task Force. In the course of our monitoring and surveillance of compliance across the nation, we have observed an escalation of the level of non-compliance with simple measures to keep social distancing, wearing of masks in public places, sanitation and hygiene. This is more prevalent in markets, motor parks, and some places of worship. I wish to remind you that the Presidential Task Force has already issued guidelines for mode of operations at places of worship, in markets, and other related public openings, and we urge state governments to ensure strict compliance with the PTF guidelines. We wish to re-emphasize that all relaxed measures are still subject to review, and advisories issued are for personal and public safety purposes. The breach of the ban on interstate travels is also a point of concern. Over the last couple of days, you must have observed that the daily figures of the confirmed cases have been on the rise. This is an indication that we are conducting more tests across the country and that we are fully in the community spread phase. We, however, urge Nigerians not to panic, but to cooperate with the public health officials, especially where community testing is ongoing. Since the beginning of our multi-sectoral national response, we have described medical personnel as our frontline workers. We also continuously pleaded with Nigerians to take responsibility. The reality of today is that the table has turned, and the community spread phase has suddenly made the health workers our last line of defense. The full import of this situation is underscored by the following quotes from Dr. B. Kalinawaga. I had cause to receive this from somebody yesterday who sent it on my WhatsApp page. And this is the quotation from Dr. B. Kalinawaga. He says, I quote, "The war has shifted to the community, and it is up to you. This cannot be won in the confines of the hospital. We, the healthcare workers, are not your frontliners any longer. We are your last line of defense. You, my fellow people, are the frontline workers now. Ladies and gentlemen, let this sink. You are responsible for protecting yourself, your family, the community, and the country. Gatherings are still not okay of any form. We must avoid it, either driving shows, rallies of whatever category. Be responsible. Lifted restrictions does not mean carelessness and that life is back to normal. Yes, there is a normal, but it's a new normal. The PTF appeals to state governments to embark on wider community testing, enforce rules on social distancing, step up community engagement and risk communication, and pay attention to places of large gatherings. We also appeal to the security agencies to enforce the ban on interstate travels very strictly. We have received reports that some states are contemplating the opening of schools, television viewing centers, sports stadiums, and other places where large gatherings could take place. The Presidential Task Force re-emphasizes that it is not yet safe to do so, and that utmost caution should be exercised in this regard. The PTF guideline should be complied with while considering decision of this in the future. In line with revised protocols, the evacuation of Nigerians stranded abroad has resumed. Over the last weekend, we received 269 from India, while another 102 arrived from Egypt. All the evacuees tested negative before boarding the plane from their destinations and will be retested within 72 hours of arrival in Nigeria. Last week, the Economic Sustainability Committee, led by His Excellency the Vice President, submitted their report to Mr. President on how to address the post-COVID era. This underscores the plan that the federal government would continue to implement measures meant to safeguard the economy. The Presidential Task Force will continue to be guided by the recommendations of the committee in taking some of its far-reaching decisions, as we have done on previous occasions. A lot has been published regarding the studies carried out on asymptomatic individuals and their contacts, to how many develop COVID-19, and the finding that such transmission was very rare. While we note the clarification of the World Health Organization that the interpretation raised a number of questions on the implications of current preventive recommendations, the PTF shares the World Health Organization's position that comprehensive studies on transmission from asymptomatic people are difficult to conduct, but are needed to draw wider conclusions. Some modeling have tried to establish the proportion of asymptomatic patients that may transmit, and there is a big range depending on the models used. But some estimates are that 40% of transmission may be due to asymptomatic cases. The Presidential Task Force shall remain conscious and shall adhere to already recommended measures, particularly physical distancing, wearing of masks or coverings in public places, hand hygiene, and cough etiquette, until we have more evidence to propose otherwise. I now call on the Honorable Minister of Health, followed by the DG of the Nigeria Center for Disease Control and the National Coordinator, and thereafter our ministers, to give you updates on new issues. I thank you for listening.
Honorable Ministers, Permanent Secretaries, Directors General, Directors, ladies and gentlemen of the press. Yesterday, 403 new COVID-19 cases were confirmed and added to the number we have to increase the total to 16,085 that have been registered in Nigeria. We have treated and discharged 5,220 persons and sadly lost 420 to COVID-19. The case fatality rate remains at about 3%, which is lower than many countries, but not a cause for relief. The increasing pace of testing will yield more cases, but we need to also be proactive in keeping fatalities low, and this is not impossible. It is still strongly advised that those who test positive present themselves at a treatment center, and this is most especially so for those with underlying ailments like diabetes, hypertension, cancer, HIV, tuberculosis, or those who are 60 years old or above. These are the vulnerable population and form the majority of fatalities of COVID-19. The reason for giving special attention to this category of people is that COVID-19 symptoms can start very mildly with slight fever, slight cough, loss of sense of smell or taste, but suddenly escalate within days or hours to shortness of breath in no time at all. In conversation with Lagos State authorities has reported that people who delay going to hospital and begin treating themselves at home are at risk, and they are the majority of the victims. And those who have had underlying ailments and delay are the ones who barely can make it to the doorstep of the hospital. Early registration for treatment for vulnerable population will save more lives. Our response in tracing, testing, and case management is driven by data and evidence. I will continue to adjust our protocols for quarantine and treatment accordingly. We are collaborating with states to strengthen the response according to needs. An arrangement has been reached to send such a collaborative team to Cross River State in the next few days to complement the work of the state government there. Apart from fighting COVID-19, the state government is also engaged in border patrol work because of the border they share with Cameroon and the unrest on that side of the border. The team to Cross River will be led by the Executive Director of National Primary Healthcare Development Agency, Dr. Faisal, and will engage in a technical handshake with the state Emergency Operating Center. Representatives from all departments and agencies, including NCDC, will be invited to go along, and also the Department of Family Health, Hospital Services, and epidemiologists. And because of the fact that they have a port health services will be included. Efforts are ongoing to increase the number of laboratories, and with priority given to states which presently do not have a laboratory with PCR capability, and these will include Cross River and Kogi states. We plan to be able to engage Kogi State in a similar manner within the next few days. We commemorated World Blood Donor Day yesterday, Sunday, and the theme of which was Safe Blood Saves Lives. That occasion was a clear reminder that despite COVID-19, other diseases and other problems still remain within our health system. We must not forget those ones. I interacted with Nigerians on social media platforms on the importance of blood as a critical and indispensable healthcare requirement for life-saving in maternal and child care, especially bleeding after delivery, severe anemia, sickle cell anemia, and in saving lives of victims of accidents. All of these are still going on as we talk. The advent of COVID-19 has affected the collection of blood and processing of blood because donors are not coming out as they used to. I had the honor of meeting with Mr. Akpan Nathan, a voluntary donor who holds the record of having donated blood 63 times. I salute him for his contribution. COVID-19 will be with us for a long time, and we shall keep learning as we go along. As part of that, the Ministry of Health is just putting finishing touches to a health sector response action plan to cover the next 3 years, divided into near, medium, and long term. It will be, of course, subject to modification as we learn more about COVID-19, but we provide guidelines for the health sector on how to prepare and rearm itself. It's a work that has contributors from some of the most learned experts in this country. Before I take my seat, I wish to advise again that we all adhere to the advisories on hand washing regularly or the use of alcohol-based sanitizers, to maintain physical distancing, and to use a face mask at all times when outside the homes. I shall be showing a small clip that came from outside the country that demonstrates in its own way the value of wearing a mask, as simple as it is in protecting oneself. The mask is not the only protection you can have. It is recommended to be something you use along with other measures. And I shall urge you all to look at this one carefully and learn some lessons from it. Thank you very much.
We have an important message for all of you, especially if you live in a country that is right now facing the new coronavirus. The pandemic is growing exponentially in many countries, but the Czech Republic is one of the few in Europe that has significantly slowed down the spread of the virus. In this video, we would like to tell you what we did differently, and mainly, we would like to help you to do the same. We are following social distancing and the rules stay at home. But others do that too. We also have strict hygienic procedures. Others do that as well. But the main difference is everyone who has to leave their house has to wear a face mask. Everyone. I know, they maybe told you that masks wouldn't protect you, but there are studies proving that even a homemade mask can be partially protective. Partially. Any protection is essential today. But now the more important thing. Masks fundamentally prevent the transmission from you to others by sneezing, coughing, but also breathing. And many people are the most contagious before they start showing symptoms. So, when we both have a face mask, I protect you, you protect me, and we are both safe.
Based on recent data, we know that population-wide use of masks is essential for suppression of the outbreak.
According to our professional experience, a simple homemade mask can prevent up to 100% of the spread of potentially infected microdroplets.
The more people use masks, the less virus can be distributed and fewer individuals are exposed.
Just a few days ago, people were laughing at those who wore masks. But some people knew about this positive effect and started to share this information across social media. The message grew fast through artists, influencers, and others. I know, face masks aren't in stores, right? But something incredible happened. People started making homemade masks and giving them to others for free. Many companies, theaters, or even retirement houses changed their buildings into sewing rooms, and thousands of people started to sew masks at home. So we know that face masks work, and it has been repeatedly confirmed by scientists. We know that it is possible in just 3 days to provide face masks for 10 million people in one country. And we know that here we have fundamentally repressed the infection. Please share this knowledge and help us to change as many countries as possible. Take a picture with your face mask on and share it with the hashtag #MasksForAll. It can really save lives. And remember, I protect you, you protect me.
They're going to be coming out with regulations on that, and if people want to abide by them, frankly, I don't think they'll be mandatory because some people don't want to do that. But if people wanted, as an example on the masks, if people wanted to wear them, they can. If people wanted to use scarves, which they have, many people have them, they can. In many cases, the scarf is better. It's thicker. I mean, you can, depending on the material, it's thicker. A recommendation's coming out. We'll see what that recommendation is. But I will say this, they can pretty much decide for themselves right now.
Secretary to the Government of the Federation and Chairman of the Presidential Task Force, Honorable Ministers, colleagues, gentlemen of the press. Today, I will follow on the same theme because it's very important. Understandably, we are all craving for a return to some sense of normalcy. And in the past weeks, people have become very anxious about this. and have really challenged all the norms that we have tried to introduce across the country. Everywhere around us, we see an increase in high-risk behaviors that is inevitably leading to more transmission. We're seeing cases increase. We're seeing deaths increase. Yes, we know it's hard to completely prevent exposure, but we have to do that which is possible for us to do. Just like we've seen from that video, there are many important lessons to learn from other countries. But there are also many lessons to learn from countries. If any of you has watched events out of Brazil in the last few days, and you're Nigerian, you'll be worried. Yet, they have the second highest death toll in the world right now. If you're also interested in learning what is happening in India, another country that has a lot in common with us, they have the fourth highest number of confirmed cases in the world. We're seeing an increased number of cases, and we really have to think about this in very clear and unambiguous terms. It's not just in Lagos. Yes, our highest number of new cases is still in Lagos, but we're seeing increasing cases in many states across the country. And yes, we have eased the lockdown, not because we wanted to, but because we had to, in order to sustain livelihoods. And the chair of the PTF has referred to this severally. But we simply have to take more responsibility around the three interventions that are in our hands, around mass gatherings, and hand washing. I call them the MMW. Many people call them different things, but it's extremely important that we do more of this. And yes, that a church or a mosque decides to open doesn't make it compulsory for you to attend. Attendance is still a personal choice. That the supermarket in Abuja decides to do a concert doesn't make it compulsory for people to attend. The attendees are making a personal choice. Yes, there will be circumstances where it will be difficult to make those choices, but at least in things around leisure, those are the things that we have to make some personal sacrifice around. And even when airlines open and when travel open, we all have to think very hard. How important is that trip to us? How important is it? And this will be hard choices. The hardest choice is probably that of my brother, the Honorable Minister of State for Education, because we all know how important education is for our children. But we have to do the ones that we can do. And that's really why today you'll see from the chair of the Presidential Task Force, from the Honorable Minister of Health, and from the few comments I'm sharing, we really have to push harder on the things that are in our hands, those things that we can do. If you doubt that they work, you can look at the evidence around it. We must just do it more, do it together, and do it consistently. And yes, behavior change is hard. Many of us lived in Nigeria when the wearing of seatbelts, the not wearing of seatbelts was the norm. But now everybody goes into a car and puts on a seatbelt. It was a new norm a few years ago that became the norm. So we may not get there with face masks forever, but we do have to do this for the next few months. So we have to make it socially unacceptable to be seen outside the home without your face mask. And we have to hold each other accountable for this. We must push harder on each other to wash hands and surfaces regularly. And finally, we must discourage each other from mass gatherings that are not necessary. In the mass gathering that happened in Abuja that has been all over the social media, there were people there, Nigerians that looked at each other in the eye and said nothing, and celebrated each other for being there. Not a single person stood up and said, in the context of what is happening, for the sake of my parents at home, let's stop this concert. So yes, there will be a lot of discussion about the mall, about the regulations, about the flights, and you hear some of them. But for me, the most disturbing thing is the people that attended and said nothing and enjoyed that day with everyone else. So I'd like to end by just saying the health of each of us depends on the actions that each of us is going to take over the next few months. Thank you.
Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So first of all, I would like to just say that we had a very useful and productive meeting with members of the Public Accounts Committee today at the National Assembly from the House of Representatives side. It was very clear from the discussions we had, this was really a fact-finding and information-sharing event, but it was very clear from the discussions we had that there continues to be some confusion about the funding stream in terms of the PTF and how the COVID program is funded across the country. So there are several funding streams. If you look at from the government side, from the federal government side, there are 2 or 3 funding streams. The first one is money that is derived from the MDAs that represent PTF. This is the 2020 budget that has been identified for the purpose of COVID. And this money belongs to the MDAs, and they are responsible for spending the money. We then have a special intervention fund. That special intervention fund, as approved by Mr. President, is specifically for the purpose of COVID-19. And that money at the moment, which is about 22 billion, sits with the PTF, and the different MDAs all have a share of it, but they can only spend it following strict rules in terms of their submissions, in terms of submitting a procurement plan which will be approved, in terms of submitting a work plan, and if they have spent money, they need to provide a retirement in order for us to pay. At the moment, with that specific amount, we have only spent 0.02% of that. Most of it went towards the evacuation, towards the accommodation of Nigerians that were brought in the last few weeks. That money will be spent if the level of evidence provided to the PTF is good enough. It has to be good enough for the MDAs to be able to spend money. It has to be at the same level as you would expect with the different MDAs. There are some commitments that are going through, but the key thing to remember is we have to have transparency and accountability, and those funds will only be spent if there is clear justification that the process that needs to be followed has been followed. So that's the government side. We then have the private sector. From the private sector, we have COVID, which is the Coalition Against Coronavirus Disease, which is co-chaired by the CBN, Governor Alhaji Aliko Dangote, and the Chief Executive of Access Bank, and some business entities. This is an entirely private sector arrangement. It's an initiative of the private sector. We do not see that money. We do not touch that money. And we can only provide advice to them in terms of what we feel they should do that will be in the best interest of the country. So for instance, we could say to them, well, we need isolation facilities in this city. or we need to increase the number of critical care beds in this city, or can you help us to fund testing, additional testing? For instance, with the Nigerians that are being evacuated at the moment, for Abuja, part of that testing is being supported by Dangote Foundation and initially through arrangements with COVID. So that's where they fit in. We do not keep their money, we do not touch their money, and we do not have any oversight of their money. This is a private sector arrangement. And then there's another funding stream which is from all of you Nigerians. And this is money that is paid into about 5 commercial accounts, ranging from, I think, First Bank, GT, etc. And it has already been advertised, and these accounts collect money across the board from Nigerians. At the moment, I think that's about 850 million, and the money is then mopped up on a weekly basis by the Accountant General and kept with the Accountant General. And the money will then be utilized later on to supplement what comes to the PTF in terms of the Special Intervention Fund. But I must emphasize, the PTF is not a procuring entity. Neither is it an entity that has accounting rights in the same way that MDAs have. But we do authorize payment to the Accountant General if the process has been followed by those MDAs. And then we then have a host of other entities that provide commodities. But before then, I will talk about the UN Single Basket. Again, the UN Single Basket is a conglomerate of mostly multilaterals and bilaterals, including the EU and the UN system. And they have their own system as well. Their money stays with them, but we support them by providing proposals that go through the UN system. They are acknowledged, they are approved, and then their money is spent. Again, the money does not come to us. We then have entities that provide donation in kind, so commodities, PPE, test kits, etc. We will have a live dashboard that we will make available. We are committed to transparency. We'll make available that live dashboard that will show clearly what we have received as government for the COVID response. How many PPEs we've received, where they have been sent to, how many test kits we've received, and what our current stock levels are, etc. We will make available that, and we will also make available our harmonized budget once the new budget is finalized by the National Assembly. So that's to do with the expenditure. I think it's important for the general public to understand the process. In terms of flights, I'm sure the Honorable Minister of Foreign Affairs may want to update us further, but just wanted to let you know that so far we've brought in just over 300 Nigerians, and this week we will start the process of bringing in up to 500 persons into Abuja and 500 persons into Lagos. The key criteria for coming into the country is the need to have a PCR test for COVID-19 before boarding, and this needs to be valid within a 2-week period. We are aware of the difficulty of obtaining this test in certain countries, and we will be looking at this in further detail, but we can already see some of the advantages of having this pre-boarding test. We had a host of Nigerians that were tested last week, and some of them were positive, and we had to decline boarding for them. We hope they will clear their infection so that with the next cycle of flights, we'll be able to bring them home. My appeal really is to those that are coming in, the evacuees, to please cooperate with our guidelines, and when we ask you to self-isolate at home, please do so. We will arrange for a repeat test, but you need to self-isolate for 14 days regardless of the result of that test, because you could be in the incubation period. And I would like to express our gratitude to Dangote Foundation as well as the Lagos State Government for making this process as smooth as possible. Finally, the DG and CDC has already mentioned this, but we continue to be very concerned about the level of compliance with some of our guidelines, particularly looking at what's happened in Abuja over the weekend. It's very important to say that this pandemic is far from over. Do we want to get back to normal? Yes. If we want to get back to normal, then we need to start complying with the guidelines. The earlier we comply with the guidelines, the faster we'll be able to get on top of this pandemic. There are no two ways about it. Behavioral change is the only thing that can overcome this. We already have a lot of Nigerians dying. At the last count, more than 400 have died from this pandemic, people that possibly could have been alive with us now if they hadn't contracted it. I know it's very difficult, behavioral change is very difficult, but some aspects of it, like hand washing, for instance, is part of and parcel of our culture. As we say, cleanliness is next to godliness. So to say that we are tired of washing our hands, I'm afraid is not a good excuse. It's important that we continue to maintain our personal hygiene, and it's part and parcel of protecting ourselves from COVID. But more importantly, we are relying on the public to please be each other's keeper and to respond and remind people that are not wearing masks in public to please and do so. Thank you.
The Presidential Task Force, honorable ministers, members of the PTF, gentlemen and ladies of the press. There's been recent media attention drawn on a statement from WHO on the risk of transmission from asymptomatic patients. And I'd like to provide further details on that statement. First of all, an asymptomatic patient is someone who is infected but never goes on to develop symptoms. This is different from pre-symptomatic. These are people who are infected as well, but have not yet developed symptoms. During WHO Global Press Conference last week on the 8th of June, WHO did mention that asymptomatic transmission is very rare. And we want to provide further details on that statement. We did provide it subsequently through our headquarters on the 9th and 10th of June. But it's important that also here at home that we understand what that statement meant. This statement was referring to a subset of studies and data shared by some member states on detailed cluster investigations and contact tracing activities. In those specific studies, where asymptomatic cases were followed, it was very rare to find secondary transmission. COVID-19 is caused by a new virus, and we are still learning about the disease every day. We need more data to understand better the transmission patterns. Current evidence suggests that most transmission of COVID-19 is occurring from symptomatic people to others in close contact. But please be informed that it is still unknown how much transmission is driven by people without symptoms. The studies that were quoted, the data that was quoted was from a small set of studies. We need comprehensive studies on transmission from asymptomatic individuals, and these are quite difficult to conduct. Some modeling groups, as the SGF mentioned, have tried to estimate which is the proportion of asymptomatic people that may transmit. And there's a big range depending on which models you use and which country this comes from. Some estimates give as high as 40% transmission, may be due to asymptomatic cases. We want to remind everyone, since early February, WHO has said that asymptomatic people can transmit COVID-19, but we need more research to estimate the extent of asymptomatic transmission. The research is ongoing, and we are seeing more and more research being done. Till we have more scientifically based evidence available, the recommended comprehensive measures for prevention, remain in place. These are hand hygiene, cough etiquette, physical distancing, and use of masks. Thank you.
Good afternoon, gentlemen of the press. So the brief today is for the unfortunate flight that was approved by Civil Aviation to come into Abuja, and the passengers or contents of that flight conducted a concert. Well, we approved a flight, but certainly not for any musician. The flight from the application was to convey Honorable Justice Adepobe Okoji from Lagos to Abuja and back to Lagos for an official assignment. And in this challenging time, in our wisdom, we considered judiciary to be part of essential service to be delivered, having to move the Honorable Justice from Lagos to Abuja was in order. The approval was given for the 14th of June, 2020. However, we do give them a window, a leeway of 24 hours, sometimes due to operational reasons. Either they can operate the flight slightly earlier or slightly forward within 24 hours. In this case, the operator chose to fly on the 13th at about 6 o'clock. So that in itself is not a violation to operate earlier because we gave him the leeway. The operator is Executive Jet Services, and from Lagos to Abuja and Abuja to Lagos for that mission. The approval was was very clear, and I will read part of the approval. And this is the letter from Ministry of Aviation to the Chairman of the Executive Jet Services, and it reads in part, signed by the Director of Air Transport Management on my behalf, having duly approved it. And he goes, I am directed to refer to a letter dated 11th of June 2020 on the above subject matter and to convey the Honorable Minister's approval for your company to operate a return flight from Murtala Mohammed Airport, Lagos to Nnamdi Azikiwe Airport, Abuja on the 14th of June 2020 to drop off Honorable Justice Adepobe Okoji in Abuja for an official assignment. The details of the flight operation as stated in your letter are as below. And second paragraph said, I am further directed to request that you ensure that this operation is strictly and diligently based on the protocol guiding the operation under COVID-19 as issued by Nigerian aeronautical authorities, most especially the all operators letter issued by Nigeria Civil Aviation Authority with reference as such and dated on the 28th of March 2020. And the keywords there are diligently and in accordance with the protocols of COVID-19. The COVID-19 protocols have been read here before you severally, and we're all very aware of it, and I've tweeted it also severally. The document also that we give the control tower for approval is also here. In that document, the Honorable Minister of Aviation has granted approval for Executive Air Services to operate a return flight to Abuja from Lagos with such details on the 14th of June 2020 with 24-hour leeway. Operation must be strictly under COVID-19 protocols. NADC and other security agencies briefed accordingly. Now, the operation is a clear violation of our approval, to which we take very seriously. And it seems that this is becoming a norm. Perhaps it's the second time. So Executive Air Services operations are hereby suspended indefinitely. We will also fine them maximally according to the law. The captain of the flight will also be sanctioned for giving wrong information to the control tower, and also appropriately in accordance with our law. Now, it seems also that people are not tired of trying our resolve. Well, we also are not tired of living and rising up to the challenge, and living and rising up to our own responsibility for keeping every one of us safe. Governance is a serious matter. We don't take things lightly in civil aviation because it means the lives of people. We are highly regulated, we are international, and we are one aviation. Going forward, we will put up mechanisms in place or escalate the mechanisms that we have in place to deter people from doing so, and it also means there will be stricter in our approvals. And whoever dared us will meet the consequences. Thank you very much.
Regarding the evacuations, we're happy to state, as the national coordinator mentioned earlier, that the mechanism that the Dangote Foundation and others have put together to obviate the need for evacuees to check into hotels for 14 days is now fully implemented and moving ahead well. So it's excellent news for the evacuees and, of course, their friends and families here, because it's going to permit us to move at a more, to be more predictable. It gives us more predictability in these evacuations, and also will enable us to bring more people back. As the national coordinator mentioned, the capacity that we're looking at is for 500 people a week for Lagos, 500 in Abuja. So that's, you know, about 1,000 people that we hope to be able to be bringing back weekly. And we started already with 260 passengers that came in from India, and we're particularly delighted that we were able to bring them back, because it's been a long while in the planning, and of course a lot of them had gone to India for medical reasons, and so the time it took to bring them back was something that we regret profoundly. But we're very thankful that we were finally able to bring them back with a national carrier, Air Peace, and you know, we thank the chairman for that. And there are also 102 Nigerians that we brought in also over the weekend from Egypt. So that was also very good. And this afternoon, there was a flight that brought back, you'll recall that an earlier flight from Lebanon that brought back 50 trafficked Nigerian girls, that as they were about to board on that flight in Beirut, that 7 girls were prevented from boarding. And, well, actually 8 girls were prevented from boarding. And because there were certain investigations, apparently, that the Lebanese government wanted to carry out. So we're happy to announce that 7 of those 8 girls are back today. And the 8th girl, our mission is still engaging the Lebanese authorities, because apparently there's some pending charges, criminal charges that are being filed by them. So, but our mission is, as I said, engaging with them, and we'll certainly do everything possible to ensure their return. We still have a significant number of Nigerians trying to get back home, and hopefully we'll be able to get them back quicker. The US, of course, we've already brought back Nigerians from the US, but there are others who want to come back, and we're working on that. The UK as well, we're working on. Dubai, you'll recall that with Dubai, that Emirates had scheduled 3 separate flights at the very beginning. We were only able to take 1, and so there are other pipeline flights waiting, and so hopefully we'll also be able to get them back. South Africa, a number of Nigerians there waiting to come back. Malaysia too, I've been in touch with the High Commissioner there, and there's a significant number of Nigerians, and looking to see whether we could arrange it in such a way as to pick up some other Nigerians in neighboring countries there. Sudan also, and France. So if we can organize everything well, in the next 3 to 4 weeks maximum, we really should be able to bring home all of our evacuees that want to come home. And so once again, a very big thanks to Aliko Dangote. They've really gone the extra mile to help us in this process, and also to the CBN, Governor Mefele, and the Nigerian Petroleum Company, GMD, Mele Kyari, also for helping to support financially all the evacuees that we brought back up to this point. Thank you very much.
Thank you. Before we take your questions,
Gentlemen of the press, ladies, good afternoon. From the Federal Ministry of Environment, I want just to reiterate what the NC has just said and what the Federal Ministry of Environment is doing. We are still not out of the woods. So we have instructed our environmental health officers to escalate the education campaign to remind people. Easy lockdown does not mean coronavirus is gone. He has already explained that. I'm just telling you that we are escalating our enlightenment campaign. But specifically what I want to do is to, again, repeat what he said in Hausa. There was a call that people need to be reminded. Jama'a assalamu alaikum. Bayanin da nake so in jaddada shine wanda aka yi amma da turanci. Mun san cewa gwamnatin ƙasa da gwamnatin jihohi sun sassauta wannan dokan zaman gidan. To waɗansu ganin an sassauta sun tsammani aya shi kenan wannan cuta ta corona ta tafi. Bata tafi ba, tana nan ras abinta. Ba mu ma riga mun kai can ƙoli-ƙolin inda ake tunanin za a kai ba tukuna, amma fatanmu shine idan aka ci gaba da kula da dokokin da aka sa, tun Allah yadda yanda waɗansu suke tunanin ƙasar Afirka, nahiyar Afirka ko kuma ƙasarmu nan Najeriya za a kai ga wani gagarumin lokaci da za a ce mutane miliyoyi kaza sun samu wannan cuta ko suna mutuwa, za mu iya yin wani abu yunkuri da zai rage wannan yunkurin kuwa shine na ci gaba da kiyaye da tsare dokokin da aka gindaya. Har yanzu maganan sa wannan takunkumi yana nan, har yanzu maganan wanke hannu yana nan, har yanzu maganan ba da tazara wajen mu'amala da 'yan uwa da abokan arziki tana nan. Wannan cewa da aka ya fito domin a ga cewa ne za a iya ci gaba da harka ta rayuwa da ɗan tattalin arziki ba tare da an ƙara gigita yawan cutar ba, amma ta hanyar waɗannan bin ƙa'idojin da za mu ci gaba da yi. Idan muka lura daga lokacin da ake ɗan ɗagawa, kuma dama mun san haka zai faru domin mun gani a waɗansu ƙasashen duniya, a duk sa'ilin da aka ɗaga ɗin, in mutane suka yi rauni wajen bin dokoki, yawan cutar na ƙaruwa. Kuma mun gani kwanakin baya ɗin nan muna ganin a kulliyomin maimakon da ake samun ƙarin mutane yana yaɗuwa kamar mutum 100, mutum 150, tsanani 200. Ɗan cikin kwanakin nan baya mutane nawa muka gani a rana? Za ka ga mutum 400, 500, har sau biyu an samu mutum 600 da wani abu. To wannan yana ɗaya daga cikin dalilan da yasa ake samu, saboda mutane sun fara sakin dokokin, suna tunanin ta tafi don an ce a fito. Ba ta tafi ba, ina ƙara jaddadawa, tana nan. Amma me za mu ci gaba da bin waɗannan dokoki? Babu maganin cewa mutum ya gaji, ba za ka gaji da kare lafiyarka ba. Kuma in an duba fa, yanzu mutanen ma da suke mutuwa daga wannan cutar sun fi waɗanda suke mutuwa baya yawa. To idan ko ta tafi, ya za a yi kuma mutane su ci gaba da kamuwa ko kuma mutuwa yanzu fiye da baya? To duk wani abu da za mu yi dai na ƙara kare kanmu, na taimaka ma gwamnati, ya kamata mu yi, domin yanzu muna ji muna gani. Idan da kana jin labari ne, ko ni yanzu na san waɗanda na jiki, 'yan uwa abokan arziki da suka kamu, na san waɗanda suka mutu, na san su, ba wai ji ba ne, ba labarin ƙanzan kurege ba ne, a'a na gani da idona. To saboda haka jama'a, kada mu bari mu yi fargar jaji, mu fito sai mun kamu mu koma, domin mun ga waɗansu ƙasashe sun yi haka. Wannan cutar na ƙara dawa in aka fito ba a abin da ya kama ba. Ya faru ƙasan China kanta, da yanzu ma kusan sun fi kowa ilimin abin, su ma sun fito ɗin, amma kila waɗansu dalilai sun sa abu ya faru. Akwai ƙasan Israel, akwai ƙasashe. Kada mu zama zakaran gwajin dafi, musamman idan mun riga mun gani. An ce idan kunni ya ji, gangan jiki ya tsira. Saboda haka mu ci gaba da ƙoƙarin bin dokoki. Wanke hannun nan yana da muhimmanci, sa wannan takunkumi yana da muhimmanci. In bai zama dole ka je ka shiga wurare ba, kar ma ka shiga. Kuma wannan mu'amala tazaran yana da matuƙar muhimmanci. In an ɗan buɗe ɗan kasuwanni ko ɗan gurare na ibada, shi ma a sa ido, a kula da cewa an bi waɗannan dokoki. In ka ga wani da baya bi, kai ka kauce abinka ka ja. In ka je guri ma za ka shiga, ka ga alaman ya yi cunkoso, babu alaman cewa za a bi waɗannan ƙa'idoji, ka bari ka koma wani lokaci, domin tabbatar da lafiya da kuma kare waɗansu. Jama'a, ina ƙara kiran ku mu mayar da hankali, mu tabbatar mun yi abin da wannan cutar za ta tafi tafiyan gaskiya, ba wai ta je ta dawo ba. Allah ya ba mu ikon kare kanmu, kuma Allah ya sa mu ga ƙarshen ta nan ba da daɗewa ba. Mun gode.
My colleagues, my name is Amaka Ode. I report for Arise News. And my first question actually goes to the DG of the NCDC. Can the NCDC really vouch for all the samples that are being tested in your lab network all across the country? I ask this question because there were some controversies before the weekend and also during the weekend as well, where some people are alleging that some states are cooking up some of the samples, where one person, they might take samples from one person and of course multiply it for whatever reason, I don't know. So I would like to get your reaction to that. And my next question is for the national coordinator. Well, just like the chairman of this task force have said, the blatant disregard for the laid down protocol, especially as it concerns interstate lockdown. I had an opportunity to go out of town just yesterday, and just between Abuja and Nasarawa, it's quite appalling what I saw in terms of how there's no even checks on the road. There's no, temperature measurement. All you see is somebody who's just waving the machine. So I want to know, what checks is the PTF planning to really put in place to ensure that states own the fight against COVID-19? Because you said, you know what, it's no longer in the hands of the PTF, but in the hands of the state. And the next question is for the Minister of Health. Resident doctors today declared that they've started their indefinite strike. Good thing is, they said those who are in the isolation centers and all frontline workers will have 2 weeks for them to continue treating patients. I want to know what your ministry is doing to really intervene to ensure that these frontline workers, as well as all medical professionals, are taken care of and that this strike does not go on for too long. And finally, the chairman of the PTF, well, sir, on Friday, or on Thursday actually, you made a promise to get back to us concerning the demurrage charges in the shipping industry, so I would like that update. Thank you.
Good evening all. My name is Nike Adebowale. I report for Premium Times. My first question is to the NCDC DG, sir. Sir, are there plans to track attendees of the Naira Marley concert? Then to the national coordinator, what will be the fate of Naira Marley and others associated with the concert? So lastly, this is not a question, it's just to appreciate the Minister of Health. About 6 weeks ago, I raised the issue of some health workers at Alesekweme University Teaching Hospital who haven't been paid for about 6 months. Reports reaching me now is that they've started their biometrics process and hopefully they'll be paid soon. So I just want to appreciate the Minister for that. Thank you, sir.
Good afternoon, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. Some of the questions I have actually been asked by colleagues, but I'd like to ask the DG NCDC. I listened to the presentation by the WHO representative talking about the asymptomatic patients. And if I got her very correctly, she said that asymptomatic patients can still transmit the virus. And she also said that we need more data to actually determine the extent of transmission by asymptomatic patients. Now my question is, if that is the situation, what informed that decision that led to the review of the case management guidelines as to discharging patients, that if an asymptomatic patient has stayed for 14 days in an hospital, it can't be discharged home, when we still know that they can still transmit the virus? Are we safe there? Then the second question has to do with the short presentation, the one we saw from the Czech Republic or so. I noticed two things there. One is enforcement. There was enforcement. And then the second thing has to do with the personal responsibility that we have been advocating here. Now, these two that I noticed in that presentation are weak here. Personal responsibility, a lot of persons don't. In terms of enforcement also, it appears that the enforcement agencies are also very, very weak. So my question to the national coordinator, what are you doing to ensure that enforcement of these protocols are actually kept to? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is to the WHO rep. Madam, today is World Elder Abuse Awareness Day, and it's obvious that older persons in the society need special attention and care in this COVID-19 era. So I would like to know what policy do WHO have implemented to Nigerians so that we can ensure that these vulnerable people have access to quality health care. And my next question is to the DG NCDC. Sir, you just made mention of increase in numbers of COVID cases. Sorry, sir, I don't know if you're listening. Okay. I don't know if we have predictions for the next 2 weeks and for this same increase in numbers, and what are we doing to address the numbers? Meanwhile, to the Minister of Health, sir, I don't know if the federal government has taken delivery of the drugs from Bangladesh. And I really want to know the difference between an epidemiologist and a disease surveillance officers if their job are same thing? And this, my last question is for you and the Minister of Environment. I think we need to prioritize and know what we are doing. I would also like to know if we have these disease surveillance officers across the country in all our communities, because I went through the Ebola reports for 2014 and I found out that they did a great job. So let me know what the disease surveillance officers are doing in the response to COVID-19. Thank you.
Mr. Chairman, members of the PTF, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. Let me start with you, the Chairman. Well, no doubt the coronavirus pandemic have made us to be more conscious, especially in the health sector, which you have mentioned severally on this platform. So I want to know what exactly is the PTF or the federal government doing to ensure that the health sector prepare for future pandemics, because we saw the time of Ebola, it came unannounced and we're still battling COVID-19. So beyond talking about the challenges, the loopholes in the health sector, what are we doing to rebuild this sector for future pandemics? Now, I asked a question on Thursday, so I think maybe you forgot to react to that. I said there was a training that was ongoing before COVID-19 started, and that was for newly recruits in correctional center workers. Now, because of the COVID-19, they were told to go back to their destination. At the moment, as we speak, these guys have converged back in Lagos State for the continuation of that training. Looking at the fact that Lagos is the hub of this virus, what are the assurances that the health of these guys will be protected? And finally, to the Minister of Health, I know my colleague have talked about the resident doctors. What exactly are the issues? We want to know that. Why is it taking so long? Thank you.
Good evening, Chairman and members of the Presidential Task Force and my colleagues. My name is Mitaire Ikben. I report for the NTA. My first question is to the DG of the NCDC. I want to ask if testing was majorly for those who show symptoms and others who have contact with them, then why do we have so much asymptomatic patients in our isolation centers? Secondly, for DG of NCDC, with the nation's airspace closed for weeks now, I want to ask, is the NCDC still involved in contact tracing, especially at this stage of community transmission? Then for the national coordinator of the PTF, how can the PTF ascertain the reliability of the tests to be conducted abroad for evacuees pre-boarding? Because I'm just wondering if a country's authorities want all foreign nationals to leave, they can just give all of them negative status for them to leave. So how can you ascertain the reliability of the tests conducted abroad? Then again, on the Naira Mali issue, everyone who boarded that flight were supposed to have been screened by the port health authorities at the airport before they entered the city and left the city. So with sanctions flying around, are the port health personnel going to be sanctioned as well? Thank you.
Good evening, sirs. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My first question is to the Minister of Environment. In your last submission, sir, you made mention of an engagement with aviation sector. We want to know if there is any update from that meeting. The national coordinator, sir. We always hear preparation for aviation sector at the end if flights are going to resume. What about the railway system, sir? The Kaduna passengers railway from Abuja, Kaduna are asking if eventually the interstate ban is lifted, is that going, the railway, is it going to operate? The The Chairman, sir, there is an allegation on the funds disbursed by the CBN, the stimulus package to SMEs, sir. There was this allegation of the money was shared to cronies, friends and families of politicians, the governors and senators, and there is also this a threatened petition from business owners and manufacturers that they will petition the ICPC and the EFCC. I don't know if you want to respond to that, sir. Thank you very much.
Question, which was repeated just now about Port Health. The mandate of the Port Health Services. Port Health Services is a division in the Department of Public Health of the Ministry of Health. Their mandate is to check importation of disease. That is to say, their job is to check flights and persons arriving from outside the country, whether by sea, by land, or by air. So they are not dealing with internal flights. So if you fly from Lagos to Abuja, you don't need Port Health because it's internal. But if you are flying from London or from anywhere else, you meet Port Health. So they have no issue with what has arisen here because it was all domestic. The other questions about resident doctors. Today we already had a meeting with the House Chairman on Health, House Committee Chairman, and with the National Association of Resident Doctors in attendance. At that meeting, they had not yet declared their position on the strike, but it was from the meeting that we are able to clarify many of the issues that they had been raising. At that time, I also did request that this is not the time to go on strike, not when we have such a very difficult situation on our hands. And I did request of them to show enough empathy to know that you can make your demands, we'll continue working on those demands and do not down tools, because the lives that may be lost in that process are not replaceable. But we are very certain that the issues that were raised there will be attended to, even though some of them are not very new. Some of them date back a few years, and some of them have nothing to do with COVID-19. They have to do with the residency training program, but they're all being attended to. So there are a series of demands. Some of them are not current, others, the ones concerned with PPE, for example, concerning COVID-19 have been dealt with. We have supplied all the PPEs to states and even to teaching hospitals, so that one is off the table. The one for the welfare of the healthcare workers, both frontline and back and rear line, are being attended to. In fact, there's a meeting to which we are again invited tomorrow by the Honourable Minister of Labour. He's doing a great job, and also the members of the National Assembly are doing a very good job in trying to make sure that these issues are attended to. I think that's all. Thank you.
Whether we could vouch for all the samples that we're testing. Well, we can vouch for the results of all the samples that come to us. No doubt about that. What we cannot vouch for are things that happen in our country. Sometimes samples come to us with fictitious names on them. We can't send our colleagues in DSS to start looking for who owns those names. No, we don't do that. We get samples with fictitious addresses. So when the state now has a positive result, they go to look for the person. They can't find the person. So there are many challenges that we have to deal with every day in our country, which is reflective of other things. So we keep trying to improve this, but in terms of the testing, we're doing the same standards across every lab. There's a very stringent quality assurance process now. And if anyone really still doubts the numbers, then we really have a problem. Because, you know, I was speaking to the Honorable Commissioner of Health in Lagos State over the weekend on the challenges that we're having to keep up with bed capacity to actually just manage fairly severe cases. We've seen and heard people that have passed away. You know, prominent members of the society have been infected. 4 governors in Nigeria have themselves announced they have been infected. I mean, so what else is there for people to doubt about the numbers that we release? It is in nobody's best interest to release numbers. In fact, for all intents and purposes, we don't think we're finding all the cases in Nigeria. So there are many more cases out there than we're able to find in Nigeria. I really urge everyone to take those numbers very seriously. Behind each of those numbers are people, mothers, fathers, sisters of all of us. So and every time we announce that result and take it back, that next morning, somebody is going to get a result across the country. So that number, every one of them will get a call the next morning to tell them about their status. On the plans, whether we're going to track people that came for the Naira Marley concert, no, we have a lot more important work to do than to do that. But if we have a positive from that community, we have a problem. So we do have a problem. If we are to find someone that turns out to be positive that went to that gathering, then we will really have a problem at our hands. So we hope that doesn't happen. I think Friday asked about asymptomatic transmission. So I'll break my answer in 2 simple answers. Yes, asymptomatic transmission does happen within 10 days of being infected. And after 10 days, you're no longer infectious and you can therefore no longer transmit. So you can be asymptomatic and transmit within 10 days of becoming infected yourself. 10 days, the data shows us that after 10 days, you're no longer infectious. But we extended it to 14 days. Rachel, you asked about our predictions if the numbers will increase. My answer is very simple, yes, unless there's a radical transformation on the things we talked about this morning. Unless we try a lot harder in wearing our masks, in staying at home, and in washing our hands, and all the things we need to do. We may not be able to stop transmission completely, but we definitely reduce the numbers. I think Mitare asked a final question on asymptomatic infections. Okay, yes, why we're finding asymptomatic infections and why we're institutionalizing them in our hospital. The reason is, once there's a confirmed case, we identify high-risk contacts and we test those high-risk contacts. So most of the asymptomatic cases we find are from the testing of high-risk contacts. So, and that also goes to answer your second question, that we're still doing a lot of contact tracing. That's why we're finding a lot of asymptomatic cases. So thank you very much.
Well, we completely agree with you that there have been clear violations of the interstate movement. We have formally written to the IG of police a few days ago, notifying him of the changes within the implementation guideline, which was something that he specifically requested, and also outlining some of the issues we are having with regards to enforcement, and we hope the security services will take this up. We also have security. We meet quite regularly with the security chiefs, and we'll be raising this issue in addition to some of the issues that have cropped up over the last few days in some states. With regards to the fate of Naira Marley, I believe the FCT authorities have already taken action with regards to the key organizers of the place. But the decision in terms of whether or not he will face penalties, etc., is actually a decision of the FCT authorities. The PTF will certainly support any measures taken against people who continue to violate the implementation and the guidelines that we have clearly enumerated, particularly if they continue to put public health at risk. In terms of enforcement of protocols, how do we encourage state governments? Well, right from the beginning, we did encourage state governments to set up mobile courts for persistent offenders or violators of the guidelines. But personally, I believe that the only way you can really ensure behavioral change is by engaging with people, by convincing people about their risk perception, changing their risk perception so that they are aware of the risks that they are facing. We cannot enforce people to wash their hands all the time. We cannot enforce people to wear masks in high-risk situations, even if we say, okay, on the roads, we will make sure you're wearing your mask. Well, what about in other places where law enforcement is not there? So I think the key process for making sure that these guidelines are followed is proper engagement of the communities. Making people aware of the risks, personal and collective responsibility for our own health. And that way, we will have consistency. Because if I wear the mask today because there's a policeman outside my house and tomorrow I peep out and the policeman is not there and I leave without a mask, the whole purpose is defeated because I can then transmit to somebody else. But if I know that that risk is there, I need to protect myself regardless of whether or not you have law enforcement around. You will do the right thing. And this is really the approach that we are putting forward. So what is the federal government doing to prepare for future epidemics? Well, we are in the process of strengthening health system. Our budget for COVID specifically is also looking at building isolation and treatment facilities across the 37 states that are between 40 to 45 beds, and that can also be used for Lassa fever or future Ebola outbreaks, for instance. We are also strengthening the capacity of our intensive care units. We are planning to have at least 10-bed ICUs in every federal medical center or federal teaching hospital that is functional. And that also involves a training of anesthetists so that we have both nurse ICU staff as well as the doctors to look after patients. We know that the Basic Healthcare Provision Fund hopefully is coming through finally and will have increased funding. And then from the primary care side, we are also putting through a lot of measures to improve the training of staff, particularly in infection control. Because if there's one positive thing that's come out of the COVID pandemic, is the awareness of the importance of infection control, particularly in healthcare settings. So hopefully the future is brighter, but for the moment we just need to remember to stay alive. And the best way of staying alive is to prevent ourselves from catching this infection. So how can the PTF ascertain the reliability of tests done abroad and whether national governments will push through people that are falsely negative to Nigeria? Well, I'm afraid every country has a regulation within its health system. So we've got to trust regulatory authorities in other countries, just like in the same way we expect other countries to trust our own. So I don't expect national governments to go to the extent of providing fake results. Nevertheless, if there are laboratories that ideally they should all be accredited and therefore the results should be reliable, but we are also putting through measures that would mitigate the risk of transmission in country, bringing people in country that are infected. So for instance, people would wear masks when they are within the plane. They would ensure physical distancing while they are being transported over. And when they arrive in Nigeria, remember that we will be repeating the test. And the test will be repeated within 72 hours, and we are asking people to self-isolate. So all these measures, with each measure, with each intervention, you are further minimizing the risk of transmission of COVID infection. So I wouldn't say I am particularly concerned about the risk of people coming in with fake laboratory results. I think we have mitigated that enough. I think the question about port health has already been addressed. Railway passengers, yes, thank you. Well, railway travel is part of interstate travel. When the domestic flights start, we will be reviewing, as I said, the need for continued restrictions on interstate travel. It's very likely to be rescinded. We would be working quite closely with the Federal Ministry of Transport to make sure that the necessary changes that the railway authorities need to apply in order to ensure physical distancing, reducing the number of passengers, for instance, per carriage, etc., and wearing masks, measuring temperature. They are all aware of it because we've already provided that guidance, but we'll make sure that they are ready for when we blow the whistle. Thank you.
For the elderly and WHO policy around that age group. So WHO has provided guidance on the risks of transmission, especially among vulnerable groups, such as the elderly. The current evidence we have is that older people and people of all ages with pre-existing conditions like diabetes, high blood pressure, heart disease, lung disease, or cancer appear to develop serious illness more often than others when infected with COVID-19. We advise that the elderly and those who take care of the elderly acquaint themselves of the special measures to protect themselves. We recently updated the guidance on use of masks, which states that in areas of community transmission, all those above 60 years or older should wear a medical mask, particularly where physical distancing is a challenge, and try to stay at home as much as possible in settings where we have widespread community transmission. On a more broader sense, WHO support in other areas of work outside COVID draws attention to the special health needs and the risks of the vulnerable, such as the elderly. We advocate for universal health coverage as part of the Sustainable Development Goals. The SDG 3 aims to ensure healthy lives and promote well-being for all at all ages, including the elderly. Thank you.
The surveillance team or environmental health officers at the state and local government level. Environmental health surveillance simply is keeping track of the incidence of diseases in a community, the prevalence of diseases, one. Two, collecting data on those different diseases, mode of contracting the disease, transmission, and all that. The environmental health officers from our ministry work, that is at the local government level, work with our sanitation desk that are in every Ministry of Environment, state level Ministry of Environment, and they keep track of all this. Now, in the case of COVID-19, right from the onset, we deployed those environmental health officers to keep track of that. That is the surveillance system to know the prevalence of diseases in those communities of COVID, to advise, to counsel, to know whether people are keeping with the measures to contain this virus, and they send that information back to the ministry. And then we process that information and see where are the lapses that will prevent further transmission of the disease, and how to go about also educating the people further. So this is just basically what the environmental health surveillance team does. Thank you.
Sorry, are you saying that disease surveillance officers are the same thing as environmental health officers?
Okay, no. See, okay, if disease surveillance officers will that then have to do with NCDC. Okay, because you mentioned environment, NCDC. Well, okay, look, see, epidemiology, Minister of Health, Ministry of Environment, NCDC, and other MDAs can be working in concert. Okay, from what we do, there are things that we'll report back to NCDC. They will take over from where we stop, and then they will continue with the more detailed technical, epidemiological issues in that particular community. For example, we have been working together on the issue of Lassa fever. In fact, environment team and the NCDC go to areas together. We're working together where we have our own data, we share with them, and they go from there. So it's a collaborative effort. But if you want additional information on the specific mode of disease or transmission, then NCDC can provide additional, but we work together. And the surveillance generally is knowing the epidemiological problems, issues, the prevalence of disease, distribution of the diseases, and all that in a particular community. But the detailed research now goes to NCDC. So if you want to add a little bit more, DG, please.
Honorable Minister, thank you. I couldn't articulate it more clearly than you had. This is what we call the One Health approach. Yeah, so we work together, and the distribution of disease is a factor of the environment, is a factor of the animals, and that's why we work with Ministry of Agriculture as well, and ourselves. And many of these diseases jump from species from one to the other. So it's always a collaborative effort. But we can get into more details outside the press conference. Thank you.
Let me just make a modest attempt. A lot of the questions are interrelated somehow, so I will try to tie them up. But for the specifics, let me go to, Amaka had reminded me that I gave an undertaking that I was going to respond to the issue of the demurrage. There are three types of demurrage. One is the container demurrage, the other is the ship demurrage, and the third one is the rent demurrage. The container and the ship demurrage are regulated and controlled by the ship owners. And the third one, which is the rent demurrage, is handled by the terminal operators. For that, I don't think we have any problem because there was an intervention from the Nigerian Ports Authority to deal with that. Where we have problems is the ship and the container demurrage, because when the ships came with the containers, they were unable to berth immediately. So they stayed on sea, and for a protracted period of time. I believe there is a process of negotiation that is going on, because these are private operators that do not have any kind of direct control of government institutions, because they are commercial enterprises. They have to weigh the costs vis-a-vis their expenditure to be able to arrive at a decision that would not endanger their businesses and also promote the welfare of their shareholders, because they will have to make returns. So it's a balance. But I believe that these issues will be resolved. If I have further information, I would pass that to you so that at least that will amplify the current status. Issues of interstate travels, experience between Nasarawa and Abuja. I was even going to ask, what were you doing in Nasarawa? Because once you cross that border, you have gone, except for essential services. How do we get the state governments to take ownership of this process? And that is tied to the question asked by Friday with regards to compliance and enforcement, as you saw on the video clip. And also the question asked by Rachel, when you're talking about the rising figures and the rest of it, all these things are not in silos. It's a collective response that would deal with these issues. And if you listen carefully, the thrust of what I was saying today was to say that even the state governments cannot do anything And I was very copious in my quotation of what Dr. Brian said. Dr. Brian Kaliwanga, a Filipino doctor, said. He was very, very, as a matter of fact, I've been trying to say that in the last 4 weeks. If you have listened to me conscientiously on a daily basis, I've spoken about this personal responsibility, that it is our responsibilities. And when somebody sent this quote to me yesterday, I was so excited in my spirit. I said, at long last, somebody has been able to frame it simpler, communicating it more effective and efficient than I have tried to do in 4 weeks. And what is the crux of the matter? For the benefit of doubt, let me repeat it again. And evaluate it as you listen to me read it. He said, we the healthcare workers are not your frontliners any longer. We the healthcare workers. You know, the cliche has always been the health workers are the frontliners. And all of a sudden, somebody who is a health worker says, no, we are not your frontliners anymore. And he went further to say, we are your last line of defense. Because if you don't do A, B, C, D, you will meet us in the hospitals as your last line of defense. We are not your frontliners anymore. The choice of whether you will get to the hospital is yours. That's in essence what he's saying. We are your last line of defense. You, my fellow people, are the frontliners now. What you do, what you say, your actions will determine where you will end. And it's a very serious conversation. And he went further to say that the war has shifted to the community. And it is up to you. This cannot be won in the confines of the hospital anymore. What I decide to do out of recklessness will not be resolved in the confines of the hospital. It's a choice and it's a decision, like Dr. Chukwe very passionately tried as much as possible to elaborate today. The choice of ending up at Jabimo, getting out of your car and attending a show in spite of all the guidelines and the protocols. It's yours. If I turn up there, that choice is mine. So we have gotten to a stage where no amount of enforcement will cut this through for us. It is the choices that we make that will determine what will happen. The governments the subnational entities will try to do their best. But it is the choices of the people that will determine how effective that will be. And that brings me to what Friday was trying to raise. Looking at that clip from the Czech Republic, you didn't see government officials around. You didn't see policemen or military people around. But by the conscious decision of the people, they decided that the entire country turned into a tailoring institution, and they began to produce face masks in large quantities. Because they realized that if we apply this in addition to other non-pharmaceutical interventions, the likelihood of reducing drastically the rate of transmission will be achieved. And that's the consciousness I want us as a people, as Nigerians, to get to. That we are the only ones that can work assiduously to ensure that we reduce the level of transmission now that it's been seeded in our communities. Yesterday, I got a clip from my local community in Adamawa, of a funeral of a relation of mine who passed on as a result of COVID-19. There were just 6 people by his graveside, all dressed in white PPEs, and they lowered him and walked away. The entire village stood almost a kilometer away. The people that even took the clip and sent to me must have climbed a tree to be able to zoom and take those pictures. Why? Because they realized the danger of getting close even to a corpse, which ordinarily, if it is decontaminated or decontaminated, does not pose any risk. And that's the kind of message that we need to drum into our people. That COVID-19 is real, and because restrictions have been lifted, it's not a license for carelessness. And Dr. Brian rightly says so. He said, you are responsible for protecting yourself, your family, and the community and the country. He went further to say that gatherings are still not okay. Gatherings are still not okay. Lifted restrictions does not mean carelessness, and that we have returned to normal. Yes, there will be a new normal, but not the normal of the past. And my appeal, as I conclude by answering one of the questions that was posed, is that honestly, where we are now, it's our individual and collective responsibility that will determine where we are headed. And Rachel, to answer your question, are figures going to rise? Yes, they are. The quantum in which they rise is dependent on what we do. We have not peaked yet, and we have never deluded anybody that we have peaked. All the decisions that have been taken thus far was to balance lives and livelihood, because we understand our people earn their livings on a daily basis. And because we were enabled to deal with other issues in our society, we had to take and advise the president on the balance of what he needed to do to take the steps that we took. But as for the figures, don't want to delude anybody, they will rise. The quantum in which they will rise, either exponentially or gradually, is dependent on what Nigerians do. If we decide to be careless because restrictions have been lifted, then we would have a peak that, if we are not careful, it can overwhelm even our health infrastructure. Liberty, you asked whether about the CBN stimulus and the fact that they've been allotted to cronies of politicians. I'm a politician, but I've not received any allotment for my cronies. So I assume that no other politician has received that. I believe that we need to educate our people and tell them that you don't access government money with that ease. There are processes, and we've taken the liberty of explaining the processes here. Go to the website of the central bank. You will see the categories that have, there are different stimulus. One for 50 billion, meant for the entertainment and the hospitality industry. 100 billion for the health sector, manufacturing, hospitals, and the rest, and pharmaceutical business. There is a stimulus of about 1 trillion naira meant for the agricultural sector. But all of them would be procured through a process. You must have a company. You must justify that it's being negatively impacted by COVID-19 before you can access the money. And the capacity of your company will determine what portion of that money you will get. If it's micro or macro, if it's a household, everything is detailed on the website of the central bank. But our people always assume that once government announces a particular program, the next day everybody will sit on the street expecting that it will be dropped at his laps. There is a process. So please, as media practitioners, explain to our people that they need to go through that process. To the best of my knowledge, there hasn't been any sharing to cronies or politicians, and I believe that whoever is legitimately entitled to any stimulus from the central bank, he will get that. There was a question, AIT, there was a question you asked about correctional centers. Which other one was that? Okay. The Minister of Interior was with us at the meeting, but he's not here now. He heads the Nigerian Correctional Service. We'll find out from him, because truly, this moment, we don't encourage people congregating. That was why even the batch of the NYSC that were on, they didn't have passing out parade. They were given specific dates within which to come and collect their discharge certificates. So as much as possible, we try to discourage assembling people in one place so that we can, as much as possible, protect people and slow down the rate of transmission, particularly in our communities, because we know where we are now. We know that the responsibility has been shifted to individuals. Let's not depend heavily on what the governments would do. Dr. Brian was very explicit in his in his statement that I quoted copiously. I hope the media people will make today's remarks available to you so that you can read it and digest it. Because basically what I'm saying today is that the battle has been transferred to each and every one of us. What we do will determine the outcome of our response at the national level. Thank you.
Afternoon. You've heard from the quote from Dr. Brian Kalina Wegan. You've also seen the clip that was shown. But let's take something home out of all of this. Our change in focus to community engagement and risk communication is underpinned by the fact that the war has shifted from the hospitals to the community. The numbers that we reel out every evening are real and should be taken very seriously. You and I have now become the frontliners, while the hospitals have become our last line of defense. Our actions are critical. We should take responsibility. We should change our behavior, be vigilant, report symptoms, seek help early, avoid large gatherings. Finally, remember to wear your mask to prevent transmission. Observe social distancing, personal hygiene, support community testing, submit to isolation, prevent exposure. They all represent our fighting opportunities to stop the spread of COVID-19 before we develop a vaccine. God bless Nigeria. We hope to see you on Thursday. I thank you very much.